In the previous section, we went through the innervation of all the muscles of the medial compartment of thigh. Let's look at the nerve that innervates these muscles a little closely. That nerve is called the obturator nerve. The obturator nerve is the chief nerve of the medial compartment of the thigh. It is a branch of the lumbar plexus. It is formed by the ventral divisions of the anterior primary rami of spinal nerves. The proximal part of the nerve lies in the pelvis. It enters the thigh by passing through the obturator canal, a passageway formed in the obturator foramen by part of the obturator membrane. The obturator nerve divides into anterior and posterior divisions within the obturator canal. If you look at this diagram here, you can see the obturator nerve's course. This is the anterior division of the obturator nerve, and this is the posterior division. Looking closely at the anterior division, we can see that the anterior division passes downwards in front of the obturator externus. It is separated from the posterior division by a few fibers of this muscle. It then descends behind the pectineus and the adductor longus, and in front of the adductor brevis. It also passes behind the gracilis muscle. As you can see, the anterior division passes along these muscles and gives off a branch to innervate these muscles. The adductor brevis is only innervated by the anterior division, if not supplied by the posterior division. The anterior division also gives a branch to the hip joint. Below the lower border of the adductor longus, it supplies a twig to the subsartorial plexus. The anterior division of the obturator nerve ends by supplying the femoral artery in the adductor canal. Now let's talk about the posterior division of the obturator nerve. The posterior division enters the thigh by piercing the upper border of the obturator externus muscle. It descends behind the adductor brevis and in front of the adductor magnus. It gives branches to the following muscles: obturator externus, adductor magnus, and adductor brevis, if not supplied by the anterior division. In the adductor canal, it is reduced to a thin genicular branch which enters the popliteal fossa, pierces the oblique popliteal ligament, and ends by supplying the capsule and the cruciate ligaments of the knee joint. Some of its fibers end by innervating the popliteal artery. Here, the course of posterior division ends. Other than the obturator nerve, accessory obturator nerve is also found in the medial compartment of the thigh. This nerve is present in about 30% of individuals. It is also a branch of the lumbar plexus and is formed by the ventral divisions of the anterior primary rami of spinal nerves L3 and L4. It descends along the medial border of the psoas major, crosses the superior ramus of the pubis behind the pectineus, and terminates by dividing into 3 branches. One branch supplies the deep surface of the pectineus, another supplies the hip joint, and the third communicates with the anterior division of the obturator nerve. Sometimes the nerve is very small and ends by supplying the pectineus only. Now that we have finished our discussion on the muscles and nerves of the medial compartment of the thigh, let's talk about the artery in this region. The profunda femoris and obturator vessels are the vascular channels for the medial compartment of the thigh. The profunda vessels are related to the femoral artery and vein, and the obturator vessels to the internal iliac artery and vein. Let's talk about the profunda femoris artery first. The profunda femoris is a large artery that arises from the lateral side of the femoral artery in the femoral triangle. It descends in the interval between the adductor longus and adductor brevis, and then lies on the adductor magnus, where it ends as the fourth perforating artery. Here, you can also see the medial circumflex femoral artery. It arises from the profunda femoris. It leaves the femoral triangle by passing backwards and ends by dividing into ascending and transverse branches. Ascending branch of medial circumflex femoral anastomosis with ascending branch of lateral circumflex femoral and superior gluteal artery to form trochanteric anastomosis. This gives retinacular branches which lie along the retinacula of capsule of hip joint, the supply head of femur. Transverse branch anastomosis with transverse branch of lateral circumflex femoral, inferior gluteal, and first perforating branch of profunda femoris to form cruciate anastomosis. Lastly, we have the obturator artery. The obturator artery is a branch of the internal iliac and accompanies the obturator nerve in the pelvis. At the upper margin of the obturator foramen, the obturator artery divides into anterior or medial and posterior or lateral branches, which form a circle over the obturator membrane and anastomoses with the medial circumflex femoral artery. Both branches supply the neighbouring muscles. It gives off muscular branches and an articular branch to the hip joint. This concludes our lesson on the medial compartment of the thigh. A quick summary of what we learned. The muscles of the adductor compartment of the thigh can be remembered by this easy mnemonic. They are innervated by the obturator nerve. In about 30% of the individuals, other than the obturator nerve, a nerve called the accessory obturator nerve also supplies the medial compartment of the thigh. The compartment is supplied by the profunda femoris artery and its medial circumflex artery branch and obturator artery. By clicking on the links in the description below, you can view our associated videos on the region of the thigh.
Have you ever heard of video books? sqadia.com is delighted to present video books, medical books that have been tailored into a series of videos. sqadia.com videos are presented in the same order as the book's chapters. Explore now and make your learning easy.